Let's look at the barriers here, because you can put cost in if you like, but the average practitioner sitting out there hearing us say, gee, insulin's great, let's use insulin. What are the barriers that providers face in dealing with insulin? Who wants to start us off?
I think the biggest barrier, for example, again, you're giving so little time. You're giving 10 minutes, maybe if you're lucky in some systems, 15 minutes to see a patient. And that, you can hardly get a half of the review of systems done before you're out of time.
What, you're doing a review of systems? You're still doing that?
In diabetes, you have to.
You have to.
Gosh, you must be a really good doctor.
If you want to get paid, you better do it.
He's a very good doctor.
Thank you.
But the issue is that if, for example, why the DP4 inhibitor did so well was because you could quickly give it. The side effects were minimal. The effects were modest, but you were able to get the patient doing better quickly.
And nobody called you back.
Nobody calls you back. If you get them on insulin or you put them on a GLP-1, you're going to get a call back almost assuredly. You're going to have to go through a training program. So a lot of the things that developed and medications that are being preferred might be because they're simple. They're effective, but they're very simple and safe.
I think what Julio said is very important. One of the biggest problems with getting patients on insulin is the patients fearing insulin. They fear the shot. They fear all the baggage. They think it's the end of the line. They think that means they're really sick. And so addressing all of those questions, seeing what that feels like, and I love the idea of a shot and the finger stick done in close succession to one another. The patient then knows it doesn't hurt.
Overwhelmed.
So I find insulin very easy to start. I teach the patient myself, but they've heard about insulin sometimes for 2 years before we actually get to doing it. We talk about now, one of the options is insulin, and we go back and forth, and so by the time the insulin's needed, they know that they've tried everything else. They know it's not their fault they need insulin, and I can pull a pin out, put a tip on, dial it, give it, have them give it. I actually have them do it right there in the office, and it is simple.
You know what I hear? I hear from patients, my grandma was put on insulin, and 6 months later she was dead. It was the insulin that killed her.
Right.
But instead, it seems to me, it's because back in that day, insulin was the last thing you gave. It was the last.
And badly used.
And badly used.
But, it still takes more than 10 minutes to get over that barrier. And we don't have that luxury, certainly not in primary care.
It does not take more than 10 minutes if you prepare the patient appropriately.
Carol, you're a persuasive person.
I must
But
be.
my little trick is very good, and I hope it's a very nice little pearl to do that because when the patient starts with diabetes, first thing that you're going to say, you're going to be fine, you're going to be okay.
But
then you're going to check this thing and get this thing, this little shot there. We're not going to do it now, but eventually you will, and it's not the end of the world.
But what Carol's saying requires that the care provider has gotten over and accepted insulin, because this is no easy task for a primary care provider to do. I mean, it's much better than it used to be, but it's still not easy. To go through all the side effects of insulin, what happens if you start them on an insulin, they go home and drive and get hypoglycemic? And how are you going to, you have to teach them how to prevent hypoglycemia, how to use the self-glucose monitoring, and it's a little more complex, and it's a little daunting for the primary care provider to.
So I think that what the message I'm trying to do is to counter what you're saying. Yes, it seems daunting, but if the patient is appropriately prepared, they're educated, they're already doing testing, and you're starting it early enough, hypoglycemia becomes less of an issue.
Carol,
It shouldn't be
Carol
that
is
hard.
right, and I think you guys' concerns are out of date. Insulin hasn't gone away despite all these 10 or 12 new classes of oral agents. The use has been gradually increasing over time. What this means is that a lot of people in primary care are using insulin and using it quite well.